You know, the world's moving on very quickly from lots of personalized medicines with tissue sampling of cancer. We're now on to what's called liquid biopsy, and that's looking at circulating DNA, which is shed from the tumor in patients' bloodstream. So the volume of the tumor initially, volume of the DNA isolated initially had a prognostic significance in outcome for patients. And now we're at a point where we're able to really analyze this very carefully and look at mutations that the cancer is being driven by. And that's really the tip of the iceberg, I think. And now we're seeing that the liquid biopsy platforms are being introduced into the screening arena, and that picking up patients in parallel to maybe CT screening for lung cancer could really be a possibility. And I think that this technology is only going to get better and cheaper and more effective. And so therefore, this really opens the whole arena up to picking up cancers at an earlier stage. Even if patients have advanced disease, I'm a real believer actually that if patients get to us for therapy earlier, they're able to be better at receiving the treatment, but also tolerating the treatment. So not only is it important to pick these patients up at an earlier stage, it's also important to pick them up earlier, no matter what stage, so that you can introduce those treatments before they become too symptomatic. And that's been the main problem in lung cancer all along, is that patients decline really quickly as they progress with their cancer, and therefore they sometimes don't even have any treatment for lung cancer. So, I think this can be used in cancers where they are difficult to detect and are picked up late. And we know that 50% of lung cancers are picked up in advanced stage in a non-curative setting. So it's really important that not only we advance this technology into picking up earlier stage cancers, but also picking up patients who perhaps would be for treatment if they were diagnosed earlier, even though they may not have curative disease.